We're back because late on Sunday night, we got bill language from the House on the proposed cuts to Medicaid. He's Nate, and I'm Andrew. This is another DLC Policy Bite from our corner.
As Andrew said, language just came out and we're still reviewing and talking to partners about the impact. That said, we do want to highlight a couple of provisions for you that could impact the disability community. First up, as expected, the bill mandates work requirements for the Medicaid expansion population. There are exemptions for age, disability, care, and caregiving, among others, but a person must work 80 hours a month, do community service for 80 hours a month, be in a work program for 80 hours a month, be enrolled in school at least part-time, or some combination of these. This is a little different than what is being proposed at the state level, but as we've said, this would definitely result in thousands of Utahns losing access to Medicaid.
Next, the bill limits retroactive coverage to 1 month instead of the current 3 months, which means people who become eligible will have far less coverage of services prior to being found eligible. The bill also requires more frequent eligibility checks for Medicaid expansion enrollees every 6 months instead of 12 months. Similar to work requirements, this is just another hoop for folks to jump through that will lead to termination of their health coverage. Given the work the state has done around homelessness, mental illness, and substance use, we are particularly worried about the impact on the population by requiring more paperwork.
There is also a provision establishing a moratorium on the implementation of a number of regulations until 2035, including on eligibility and enrollment, as well as nursing home staffing minimums. The administration has already rolled back the nursing home staffing minimums rule that the Biden administration passed, something we had hoped would improve conditions in long-term care. So by preventing future administrations from these kinds of requirements mean continued problems in long-term care facilities.
The bill freezes provider taxes at current amounts and prohibits new or increased provider taxes. These are a bit complicated, but provider taxes are often placed on long-term care facilities and hospitals that help states get more federal funding. We don't know the full impact of a freeze at current rates, but it could mean states have less money from the federal government at some future date and could lead to cuts in services.
It also proposes a home equity limit of $1 million for long-term care eligibility and would prohibit asset disregards from being applied to waive home equity limits. With rising housing prices in Utah, we are concerned that this could lead to folks, particularly those with aging parents who might be left at home, losing coverage simply for having a home.
Finally, there is a provision regarding budget neutrality for 1115 waivers. Again, it's a little complex, but the concern here is that Utah's Medicaid expansion program is an 1115 waiver. Our concern is that Utah's expansion program would not be reauthorized because any reauthorization of these waivers must show that the 1115 waiver would not cost the federal government more than it would in its absence. As currently written, we fear that could be the outcome because the existence of expansion clearly costs more than if it didn't exist. But we are still digging into things and discussing with partners.
As Andrew said, and we've kind of detailed through this video, these are just initial thoughts after having had the bill for just a few hours. We will continue to dig into things and learn more. We'll share what we can on our social media or in future videos. All links on our website, disabilitylawcenter.org. In the meantime, call or email your representative and senators to tell them no cuts to Medicaid. Also, be sure to follow Protect Medicaid Utah, our new coalition, on social media and check out their website, protectmedicaidutah.org. Our partner organizations will surely have more information on impacts to communities outside of the disability community. And as always, thank you so much for watching.